Fantastic. Okay, so some of you know each other. This is actually episode 7 of this Prime Impact speaker series that I started in October. Our previous speaker was, in fact, Dr. Richard Gunton, who is also here as one of our panelists today. Today's talk will be given by Dr. Celine Benoit. She's presenting on working with community partners to tackle health inequalities. Celine is also the associate professor at University of Aston, along with holding the position of associate dean for public engagement, as well as the director for research center for health and society. I hope I got that right, Celine. Anne-Marie, so I've got two panelists today. Dr. Anne-Marie Ryan, she's joining us from University of Limerick. She's the associate professor there. Anne-Marie, I'm hoping you'll do a sort of more extended introduction when we start the panel. Also, you've got Dr. Richard Gunton. He's the associate professor at University of Winchester, and we are colleagues there at Winchester. We also have got Eleanor John. She's joining us from Switzerland, and she's currently the research associate at the University of Applied Sciences of the Grisons. So thank you everybody for joining this morning. You could tell from the title of the talk that primarily one would assume that the focus is on Sustainable Development Goal number 3. But when you go through the work that Celine has done, personally, I feel it has got strong linkages to goals 5, 8, and 17 as well. As often is the case, the interconnectedness of the global goals. So without taking up much time, so ordinarily the sort of the framework or the structure of these sessions is we start with the speaker. So Celine will have about 40 minutes. If you go over a few more minutes, it's not a problem really. And then we'll open the floor to the panelists. So we'll start with Dr. Anne-Marie Ryan. If you'd like to take the floor for 20-25 minutes, it could be a mix of comments, sharing perspectives, critiques perhaps, and of course, it's really just a conversation. So it could be a Q&A, should you decide to go that way. Followed by Dr. Richard Gunton. Again, similar format. If we do go over a few more minutes, that's okay with me. But if you do have to go and teach, unfortunately or fortunately, please let me know. We can also swap the order accordingly. So, Celine, the floor is over to you. Please take over. You okay Thank to you. Share the PowerPoint?
Yes, please. I don't have sharing rights, so I'd be grateful
if
you could do that for me, please.
Yep. You are now.
Oh, lovely. Thank you. Give me a second whilst I share my screen then. Are you able to see the PowerPoint from here?
Not just yet, but
okay. Give you a minute just in case.
Yep. I can see it.
All good.
Everybody can.
Great. Thank you very much. Well, thank you very much for having me this morning. I'll try to keep an eye on the clock, but if I get close to the time, feel free to give me a 5-minute warning and I'll stop talking. So this morning I wanted to talk to you about a project on which I'm working with different stakeholders in here. So we've got the NHS and we've got the voluntary and community sectors working with the university. So we are at Aston University. And we're very much focusing on the UN SDG number 3, which is good health and well-being, although, as Rick said, of course, it will overlap with other UN SDGs as well. And I have been asked in the past, so one of my hats, one of my roles is associating for public engagement for the College of Business and Social Sciences. So I'm a sociologist in background, but I also very much work very closely with the business school. And one of the questions I've been asked in the past is like, why focus on good health and well-being, you know, from the perspective of the business school and other schools. And we were talking about the basically the economy is suffering quite a lot because of ill health. So we know we've got, especially since COVID, we've seen a high number of people being off sick, not returning to work as well. We also know that poor health reduces global GDP. We know that we could have a more productive workforce as well in the working age population if we were to tackle barriers that lead to poor health outcomes. And also, I think because this is the right thing to do, we know that health inequalities are unfair. We know that they're caused by social and structural determinants of health. So we know that the poorer we are, the more likely we are to be in poor health. So and because of where we're located at Aston University, it is the right thing to do as well in terms of us acting as a civic university. So Aston is located in Birmingham, but we're very much near the east side of Birmingham, which is characterized by high levels of deprivation. So it's about working with our local communities, local community groups as well, to better support, to help tackle health inequalities. So now it's not uncommon to have projects that look at working and supporting health. And the way we've done it is slightly different. We've partnered with different stakeholders, as I said earlier, and one of the key projects that we have is called Community Connections with an X. Excuse me. So Community Connections is a project that is co-led by two NHS trusts. We've got the Birmingham Community Healthcare Trust, who's the main lead, and there's also the Black Country Community Healthcare Trust. And so they're both working with us at Aston University. At first, one of the main aims was to try and break barriers to research, because we know that when we're doing research in the area of health, when we're looking for participants, we're very more likely to find white middle class people volunteering into research, and therefore the research is biased and skewed. So we were trying to break those barriers down. And actually what transpired is that a lot more work needed to be done before we got there. There are lots of issues around trust and so on, which I'll get back to in a minute. But what we were committed to doing was to work collectively to tackle health inequalities and better understand what the barriers were, not from the researchers' perspectives, because again, we've done a lot of research on this in the past, but from people's perspectives, from different communities. And we were really keen to do that project with what we called underserved communities. So traditionally, we've talked about hard to reach communities. And what we're arguing is that the communities aren't hard to reach. We've just not been reaching hard enough. Or there are reasons why communities weren't coming forward to us. And it was about us breaking those barriers to make sure that they would be included in the conversation. So there's been a lot of focus on minoritized groups, whether that was racially or ethnically minoritized groups. We've also worked with refugees, and we've also worked with other protected characteristics. So this is a project that started about 2.5 years ago, and as part of the project, I have been seconded with the NHS 1 day a week. Excuse me, I'm really struggling to shift the call that I got a few weeks ago, so apologies for this. And so basically, I've got this remit of associate dean where I can work on this with the university, but I'm also seconded every Thursday. I work with the NHS specifically on this project. And one of the things that I look at is around public engagement, which is what I do with the university, but it's how can we do public engagement in a sustainable and in an inclusive way. So what I'll do is I'll present one of the projects here, and then if there's any gaps, I'm happy to fill in the gaps during the Q&A or pick up any comments after. Sorry. So one of the projects that we led on was with, so it was with the NHS, it was with the university, but it also was with Citizens UK, and we worked with voluntary community and faith organisations as well. And we held 5 listening events, and we were really clear that we wanted those listening events to be only in East and West Birmingham, because this and in wards that are really high, that are characterized by high levels of deprivations. So basically going to communities that tend to usually that fly under the radar when it comes to talking about health and well-being. We usually talk about them on their behalf, but we're not very much letting them talk to us about what it is that they're facing and what their priorities might be. So we had 5 listening events, which is not groundbreaking methodologies. It happens quite a lot. And what we did was we just approached, we worked with Citizens UK. We approached different organizations. Organizations then heard about it and came forward and talked to us as well. And we said, okay, what we'd like to do is hear from some of your service users when it comes to health and well-being. And so the organizations were responsible themselves for setting up the listening events in places that suited them the best, at times that suited them the best. And they helped also make sure that there would be interpreters on the day if they were needed. And they provided refreshments and food as well. So in exchange, we paid for this. Of course, we gave £400 to each organization who helped work on this, and helped facilitate the event as well. And so what we had about 100 people come together across all 5 different listening events. We had some groups that were, I think the smallest groups, we had about 10 participants, and we had one large group with about 35 participants. And otherwise it was more around 18, 20 participants. So it wasn't just me. As you might have seen on the first slide, I've been working with quite a few colleagues. So Angela Jeffrey, for example, Susan Cleary, Dr. Fatima Zakia. We've got Alexis Payton as well. And so what we do is we take small groups each, and we'd have note takers and so on. So we never were in a group of 35 talking to each other. It was always broken down into 5 max, and we'd have conversations. And we always had a very short questionnaire, which was really around okay, can you tell us about health and well-being? Can you tell us what's going well, what's not going so well? We were really clear that we didn't want to talk about GP access, simply because we're working with community trusts. And I don't know if you know how the NHS works, but basically the community trusts don't look after GP surgeries that belongs to another trust, and they don't work with hospitals as well, as in they don't look after hospitals. That would be the hospital trusts. So we were very much clear that we wanted to talk about other services. And what happened is that everyone talked to us about GP access quite a lot. So we had to include this into the findings, and we are working with other trusts now to bring that those findings on. I'll go over the findings quite quickly, because I think what I want to highlight here is more the methodology and the work we've been working. But basically what they were saying is that it's basically really difficult to get through to a GP. You really struggle to get through to the receptionist. Once you're past the receptionist, it's really difficult to actually secure a GP appointment. And culturally speaking, it's very difficult sometimes if you have some stigma around mental health to just disclose to the receptionist that you'd like to talk to a GP because of mental health issues. So that's probably going to make you put the phone down and not seek further help. And then at the time, there were very limited appointments face-to-face. This is starting to change, but not in all surgeries, especially surgeries that are oversubscribed. A lot of them are, but in those particular communities, surgeries were closing down. So what we were seeing were people having to go and join oversubscribed surgeries as well. And so there was also an over-reliance on the use of phones or video communications, which makes it particularly tricky if English is not your first language. And there was a lack of adequate professional interpreters. So we met with a lot of people who said that they spoke a dialect and they were being matched with the main language. So you could imagine how this would affect the trust in the quality of care, where you think, well, they're probably getting an approximate interpretation of what I'm saying rather than the actual interpretation. There were also concerns around what they felt like the NHS was quite, disjointed. They felt like when they were being referred to a service, that they had to start the process all over again, rather than the services had been talking to one another, which is quite key. If English again is not your first language, having to restart all of this all over again, and when appointments have got 10 to 15 minutes maximum, it's really, really tricky. A lot of our participants also felt like you had to go to the GP to be able to access most services, when actually it's not necessarily the case. You can self-refer to quite a lot of services, but that wasn't clear. So again, this idea that you have to go through the GP and the GP is the gatekeeper of all the services in the NHS was another issue that we needed to work on. And there were a lot of issues around maternity and infant health. And actually, most of our we didn't say we wanted to talk to just women or to just men. The sample was self-selected, and mostly women came forward. And actually, what that revealed is actually women were more likely to bear the burden basically of accessing healthcare, because they're doing it for themselves, but they're also doing it for dependents, and that could be children, or it could be also elderly family, and also relatives as well. So they had quite a lot of people to look after, and they're usually the ones who have to navigate a really complex NHS system. So we had moms who were saying to us how, for example, at that particular surgery, the receptionist wouldn't even pick up the phone, so they'd have to go and queue outside the surgery at 7:30 in the morning, hoping to be within the line at 8 o'clock when the surgery opens, and then realizing that at 8:30 they're still in the queue. They have to leave the queue because they have to go back to school they have to go back home to do the school drop-offs, and then they've missed out on the GP appointment. And so women usually were the one really struggling with those issues. And on top of that, they had the antenatal and maternity care as well. And a lot of them expressed that actually they often felt like they were a burden, or they felt like they weren't necessarily getting the right support in those services. And so sometimes they even actually chose not to access the services, even when they were having difficulties, including reduced movements. So that was a real issue. They talked about behavior such as rolling the eyes, or having issues with the languages not being English not being the first language, and not being supported in the right ways. Health visiting as well was another issue. So I'm not going to go over language and cultural barriers, because I think you've been able to pick up on those as I talked about some of the findings. But basically, what was really coming out of all the listening that we've done is the lack of trust in the quality of care. And it's not like it was never there. It was actually there, and it's just been eroded over the last decade or so. So this is in line with the funding, the defunding of the NHS. Basically, what we're seeing is also a decline in trust in the quality of care. So if you feel like people aren't talking your language, or are not being your language isn't interpreted in the right ways, that's going to affect quality of care. If you feel like the services aren't talking to each other, you're going to feel like it's affecting quality of care. If you can't access a GP surgery, you're going to feel like, again, there's poor quality of care. And too many people ended up having to go to A&E being oversubscribed, and we know that the length in queue can be between 6 and 8 hours minimum. Again, that will affect quality of trust. And mostly people were saying that they felt like they were saying, okay, we really appreciate a lot of the staff at the NHS. We can see they're tired, we can see they're overworked, we can see they're stretched. And there was this idea of not wanting to add to the pressure, but also this idea of, but what about us? Do you care enough about us to still, to still provide us with the right support of care? So what we did next is, once we had all of this data, there was a lot around children and young people as well, being one of the many worries that families encountered. But what we did with the data, we broke it down, and we presented it back to the organizations that worked with us. And this is what I really want to focus on, is the methodology and the way we worked. And we didn't work just with the organizations that had taken part in the listening events. We opened up the project to any organization that works in East and West Birmingham in the wards that we went to, and that had some kind of mission to support the health and well-being of their service users. And so we put in the newsletter of the Birmingham Voluntary Service Council, and also through social media, an open invitation to what we call the Community Sandpit event. And the idea was that anyone who's interested to talk about health and well-being in those localities are very welcome to come. And travel was refunded, the event was free, the lunch was included, and we said that as part of the event, what we'd like to do is fund some projects to help support people in those localities. So we ended up having In total, about 7 organizations. There were more who were interested in joining, but actually only 7 on the day turned up. And the idea of the sandpit event was that the data is the sand, and we're going to get together in the sandpit and we're going to create something out of it. And we just don't know what it will look like because the community partners will be the ones directing what the project should look like. We didn't have very much money, but we did have £9,422 that were made available by the university through the policy support funding and the Birmingham Community Healthcare Trust. And so what we said to our partners were, okay, this is the data. I think most of them weren't surprised by the data because I think they heard a lot of this on a daily basis. But we said, okay, what do you want us to do about it? We know we have a longer term plan, which is to try and work with the Birmingham City Council, to work with public health, to work with the NHS England, and to work with integrated care boards to try and alleviate some of the issues and some of the barriers we've encountered, to tackle, to make sure that interpreters are available more readily, to talk about funding on a serious basis. But these are more long-term basis. What would you like to see happen more right now if it was possible? And so they worked together, and what was different is that we spent the morning looking at the data, talking about things, sharing insights, really delving into it, asking questions. We went together for lunch thinking about, okay, what do we want to do and so on, and provided this opportunity for networking. And then when we came back in the afternoon, me and colleagues were available and helping the organizations fill in a very, very small form. It was a 2-page document, which was, okay, what would you like to do? Please give us a breakdown of the type of activities you'd like to provide, how much that cost, when you'll be running them, something very simple. And what we ended up funding was 5 different projects. The first one was a sewing project. We basically bought 12 sewing machines and someone to come to Aspire and Succeed for about 6 weeks to show women how to use the sewing machines. And as of today, so 2 years later, we know that the sewing club is still being run on a weekly basis every Monday. And we know that the skills that were being picked up by the women at the time are being passed on to new women. What the scheme was about, it was about tackling isolation. So these women were saying that after 2 years of lockdowns during COVID, they found it especially difficult to leave the home, and they felt like they had lost their network, their support network, and they were just staying home. And they were saying we'd like a reason to leave home. And one of the things that they were mostly passionate about, and this had to do with cultural heritage, but also things that they were really attached to because of their parents or their grandparents being doing sewing a lot. And they were really keen on picking up sewing. And so we set up that sewing club. And what we thought we were going to do was we were going to tackle isolation. But actually what happened is we had ladies coming together on every Monday, and they were coming from different backgrounds. So all of a sudden they couldn't use their dialects anymore. They had to use English. And so they were actually having to speak English on a weekly basis outside of the home context, and having to build that confidence of it's okay to speak in English. And they were also starting to share tips about, like, what do you do if you're feeling poorly, or what do you do if you're, and starting to talk about feeling lonely and having those open conversations about how lonely they had felt, and feeling less, feeling a lot stronger about this. And I'll show you a video after, so I'm not going to say too much now. The other one was around digital support. So it was aimed at the over 50s, but really those who took part in the project were over 70, if not over 75 years old. So we bought IT equipment. Again, the aim was to provide training and support to people who were digitally excluded. And that had a lot to do with making appointments online, being able to use the NHS app, being able to use apps that are being recommended by the NHS to help support health and well-being. And whilst we thought we were just going to do this, a lot more came out of this project. So when the iPads and the tablets had been purchased, people actually used them and gathered together to watch football, or to look at recipe and cook those recipes together. So again, we didn't anticipate it would help tackle isolation, but that was one of the outcomes as well. Soil to Boil was with a local allotment. They've got those big community gardens, and it was they're very concerned around childhood obesity. I mean, this is an issue in the West Midlands, especially in Birmingham and especially in East Birmingham. And so they were really thinking about how can we get children to access healthy food and to look at like fresh fruits and vegetables, and try and demystify some of the myths, right? So watch them grow, touch them, cook them, add them to a pizza, add them to a stir fry. How do you add them to your local diets and so on? And they were really clear that actually they know that most families know that you have to eat 5 fruits and vegetables a day to be healthy, right? So they know the baselines, but you can't afford it. So if you know that your child is going to eat, I don't know, say chicken nuggets and chips and will be full of it, you're not necessarily going to feel like you're going to waste a lot of money on tomatoes and cauliflower if it's going to end in the bin and your child is going to be hungry. So what the allotment wanted to do was actually getting the children to come and access the food, play with the food, eat the food in a way where parents wouldn't have to just gamble and buy something that might end in the bin, and then actually the parents can go and buy things that have been discovered the allotment and they know that the child would like to eat later. The Health Hub was about building confidence for women to start exercising again. That was very, very similar to the first one with the sewing project. It was about tackling isolation, and they were not interested in sewing, and they came up with the idea that they wanted to be moving. So for them, it was about cycling. It was about going to the gym again. So what we got a personal trainer, a female personal trainer, to come to the gym and to show women how to use the equipment safely, what kind of exercises to use to age healthily, and things like that. And then the last one changed. It was meant to be an NHS Fun Day. It was about having reconnecting the younger people with the NHS. It's this idea that the NHS has disappeared from the community. So when you used to see like community nurses and you had like people around from the NHS as part of your life almost, they're gone, right? And so unless you are seeking out help from the NHS, and they're not part of the picture. And they were saying what we're finding as well is a lot of people don't look like us at the NHS. This is what, especially from the Black communities, they were saying, we're not seeing people who look like us. And what we'd like to see is seeing our kids going into the NHS, but they're not thinking of the NHS as a pathway for careers. So they wanted to show the fun side of the NHS, the community side of the NHS, to kind of reconnect the young people with the NHS and make them consider careers in the NHS. However, because of the issues remember it was 2022, and what we had seen is we had 2 years of lockdowns, 2 summers of lockdowns, and the young people were really at crisis points, and they really needed support in terms of mental health. And we needed also to keep them off the street, which is because they were in an area which is characterized by high crimes, gang violence, and so on. So we need to keep those kids away from screens for a little bit, but also away from the streets. And so what the Blast Center proposed was a 4-week activity program in response to the mental health crisis, to try and get the kids to play together, to reconnect together off the streets. So what I would like to show you, and I think I do have time, is one of the videos, because I think it's nice to hear from me, but it's actually much nicer to hear from the participants themselves. But I'm going to make sure that when I shared with you, I did include the sound. So bear with me. I've just stopped sharing, I think, and now you should be able. I'm going to include the sound, and I'm going to share my screen. Ooh, I think my computer didn't like that very much. Can you see anything? I can't hear anyone, so I don't know if it's working or not for you.
We can see your screen.
Lovely. Okay, great. Right, so we'll watch this one. Actually, that's the one I talked about the most, so we'll watch that one.
Yeah, it's working.
Sati House is a led organization run by women. We have various activities based on activities that ladies want to do.
We take it really seriously to work with communities that are around us. And one of our priorities is to tackle barriers, including barriers and that lead to poor health outcomes. So looking at health inequalities. And so we teamed up with Birmingham Community Healthcare Trust, Citizens UK, and local community organisations to look at the barriers that local residents encounter in terms of health and what is it that we could do collectively.
You might have a lot of brilliant services, but if it is not reaching out to the community, if it's not cascading it down, then there is no point. To add value to that service, you need to engage with the community, you need to provide community with more resource, understand their needs first.
I like Shati House. My friend said Shati House, everything is nice, English class, and every gym, cycling, everything.
I like it, so many activity. My lifelong dream is cycling now and then everything done now. They don't want to come out, they don't want to speak in English, they don't want to interact in English, they feel comfortable speaking in their own languages. But one thing we are doing at Sati House at the moment is empowering women to speak in English. And what I'm always encouraging them, doesn't matter even if it's wrong, just try and speak. The more you speak, the more better you will become. And there's no need to be shy, nobody's going to laugh at you, nobody's going to make any fun out of you. Just speak and say what you feel and just feel confident.
For this particular project, the funding came in through Aston University, but we as a collaborator from the Healthcare Trust, and we brought in that healthcare perspective, what we can do to support healthcare and well-being across communities.
We were having the opportunity to bring these women in this safe environment. I'm sure majority of the women have really enjoyed coming to the gym, and I feel as well it's built up their confidence.
Help everything in the Sati House. Everybody pushing, na? Team members very good.
I think Birmingham Community Healthcare is building up on a strategy currently, which involves community engagement. Community engagement is an important arm of it. But through community connections, we have done that engagement, and we understand there has been a gap between the NHS and the communities. I'm hoping that Sati House can become one of those health hubs that supports the local community, but that also gets the proper recognition that it deserves. I'm hoping that we can see Sati House getting funding to support the health programs that they have here, and that are making huge differences in communities, meeting with new people, making new partners, and getting the confidence to build projects. And this is where with Aston we're very happy to also support those women into further projects and see what it is that they'd like to do and become leaders and take any projects that they have forward and supporting them in that. I don't want to see it. So there are more videos here, and I do invite you to look at them if you can. They are really good. I'm going to stop sharing again. I wanted to share the PowerPoint, but it's not working from here. Sorry about that. So one of the things, I'm putting the PowerPoint back, I'm just going to talk to you. But one of the things that where am I? Sorry. The PowerPoint has disappeared. One of the things that was really interesting as well was that there's a tendency to talk from a privileged perspective. So too often we'll be making decisions with the university or the NHS that are quite privileged, right? So it wouldn't necessarily be obvious that actually cycling would be someone's lifelong dream at the age of 35, and this is something that they really wanted to do to be able to tackle health barriers.
So for them, it was about being healthy, so being able to exercise, but also being able to get out of the community and where they live, and also finding a safe network of women with whom they can interact. Because again, if we think about the types of communities we were working with, we have to remember that not all of them use all of the Birmingham as we might be able to think of. So we have some communities who would stay within particular neighborhoods and sometimes very restricted neighborhoods. So being able to work with the underserved communities was really important to us, because what we found is that there's a tendency to work with larger organizations, but you don't tap into the smaller communities and the smaller community groups. So let me try and get, I don't think I can get my, oh, here we go, sorry. I think you should be able to see the PowerPoint back here. Is it working?
I suspect it is coming up short. Yes, we can see it now.
Okay, lovely. Thank you. So yeah. Oh, so yeah, we got an award for this, so I'm just sharing it because, you know, that doesn't happen very often, so we were quite happy. But what we're trying to do now, oh, my computer is not liking this. What we're trying to do now is we have written a report with all of the data that came out from the listening events, but also what has come out from the St. Pete event. And using that report, we have made some recommendations. And in Birmingham, we have what we call the Black Chair or Black Chair report, which is quite prevalent in the city council. It's very much focusing on one type of community. So it's very much looking at Black Caribbeans in Birmingham and Lewisham in London. But what we're saying is actually we ought to be looking at other minoritized groups, because a lot of those recommendations apply beyond Black Caribbean groups. We are also making further recommendations, and these are listed in the report, and you may have seen them if you've looked at the summary of the report today. And a lot of the recommendations are around how we should be working a lot more closely together with the voluntary community, faith and social enterprise partners, so that we can better support everyone, so we can be more inclusive and we can work on a more sustainable basis, because we're not just working with a kind of like medium level, but we are including absolutely everyone in society. So what we are doing is we are working with public health and the NHS and the ICB, so the Integrated Care Board, and we are talking about how could we do funding in a way that is more inclusive as well. So what we found is that a lot of the community organizations that we had and did the kind of activities that we saw, so you know, the type of events, they were saying that they usually can't find access to funding for several reasons. They are either understaffed and they don't have time to look for funding, or they don't have the expertise to do that, or they've done it once and they didn't succeed, and this kind of put them off for. And when you're looking at the way that funding is allocated in the city, it's very tricky. First, it's a timed form, so you have to do it quite quickly and quite efficiently. So if English is not your first language, you're at a disadvantage. And we know that if you are in a large organization where you have people who are professionally trained to write grant applications, they're going to be more likely to secure the grants than the smaller organizations. So what we are suggesting is that actually when we are having tender processes, or when we're looking at commissioning from the city perspective, is we should include a clause that says something like maybe 10, 15, 20% of the fund has to be ring-fenced and has to be allocated to smaller organizations. So whoever gets the grant has got a duty to reach out into smaller organizations across underserved wards in the city. And then some of that money has got to be broken down into smaller projects like the ones we have shown, because you've seen that with only like 800 to £2,000, they can do quite a lot and reach out to communities that are usually left out. That's one of the suggestions we're making. We're also saying that it could be that there is a panel of experts, and that is always so it's not just an advisory panel. So that could be something else. But the panel of experts would be people who have got a say on how the funding is allocated. So if the funding is going to a large organization like the Active Wellbeing Society, for example, then they have a duty of having people from smaller organizations as part of an a panel of experts. Basically, we can have a say on how the funding should be allocated across the city, or how we can make sure that underserved communities are not being left out. What we've done as well is created a community engagement handbook, which is about how to work with underserved communities, and a lot of it has to do with issues around trust, but also issues around power, and how do you make sure that when you're working with underserved communities, you have this idea of social justice coming into the work that you're doing. So it's not just about going to the community, getting the data and going out again, because you're probably going to do more harm than good. And it's about how do you do that in a way that actually addresses the current power asymmetries, and actually that you're making sure that you're not the one in the driving seat necessarily. And that handbook is being turned into training on again on the city basis. So we're working with the Birmingham Voluntary Council Sector Service here to do that. I think I'll stop here because I am out of time, but I'll pick up any questions or any comments that you may have for me. But thank you, everyone.
Thank you, Celine. It was truly inspiring. I had a glimpse of this last summer, and I stayed inspired. So that's sort of renewed today. Thank you very much for the presentation. I've got a few observations, but perhaps I could open the floor to the panelists first. Anne-Marie and Richard. Anne-Marie, would you like to start?
Thank you so much, Rick, and thank you, Celine. Thank you for the invitation to come and listen and discuss this work with you. I'm super interested. So maybe to put it into context of where I'm coming from. So I've been doing research on cross-sector partnerships for many years, and in particular, I take very much a process perspective, looking at the unfolding dynamics between members of partnerships and how and what unfolds in that dynamic over time, if you like. But I've also been looking then more recently at partnerships from place perspective. So taking a place-based idea that around how partnerships shape places, and in a way how places become an outcome of partnering work. So I'm quite interested in that aspect of your work, but then also through a lab that I've developed in Limerick, in the University of Limerick, I've been looking. It's primarily an education framework, but it's a stakeholder engaged. So it's a futures lab. So I work with students and stakeholders to help to map current systems. So we take very much a spatial kind of perspective there again, on to map the current kind of issues and concerns and the current system dynamics, but then imagine a future one where some of those issues have been addressed, and then design the solutions. So in a way, there's a lot of correlation there with the work you're doing, and you're very much on the ground, and you're very much within a network of actors who are very active, and I'm very envious of that. And I know the work that has gone in. I can only imagine the work has gone into to develop those relationships and develop the trust, not only with the end users, but all of the organizations that work on their behalf and representatives. And there's a huge effort gone in there. I can see that. So I was hoping to kind of inflect my comments, I suppose, a little bit with the kind of insights or questions I've been asking myself, and to get your insight on. So I wanted to kind of lead out with a question. It might be, I don't know if it's the right one. Let's see. But I'm kind of getting this sort of visualization of a kind of a knowledge or research sandwich. And I wanted to get your thoughts on it. It's kind of on one slice of bread, you've kind of got already existing knowledge. I mean, as you kind of said, you know, there's nothing new, or we know already the kind of the kind of structural kind of issues there about we all already know the long-term impacts of poverty and so on. So we know stuff. And then we go into the community and with this knowledge and kind of act on it in a particular context or in a particular setting, and gain data. But as you say, hopefully more than just data, if you like, you know, it isn't just take the data and run, but there's an engagement, there's a relationship. But then at some point, researchers who are employed by universities have the pressure to produce publications. And so there's a different kind of research work that goes on at the other slice of bread. And sometimes those two slices of bread are very far removed from what goes on in the middle. You know, and the types of theorizing work that we would be doing to get an impactful research publication will be very different from what we do with the communities. And I know, like, again, reviewers aren't that particularly interested. They go, well, it's nice that you talk to all these people, but, you know, so it's the theorizing work that comes subsequent to that is really what we're being tested on, creating models and frameworks that our participants wouldn't even find that interesting. So I just wondering, so there's a tension there between engagement and impact in the community, and then impact in our research communities. And there was this one of the questions, I have more, but it's the first one that I'd love your thoughts on, and what you have yourself sort of internalized around that process, around these tensions between these different kinds of audiences that we have, or yeah. You're still on mute there.
I am sorry. Yes, you want me
That's
to pick that one up?
so
Yeah.
retro, Celine.
I will do forever. I think it is now. Yeah. Yeah, I hear you, and I have the same issue as well. And I think one of the things that we have had to be really clear about when we're working with the external partners is we talk about having different currencies and how we have to use some of that with the university or with public health, but it's not deviating us from the end point. It just means that the road doesn't, like the journey to get there might not look like the journey they thought it would look like. So we recently, in March, we had a community roundtable with over 100 people coming in from community organizations. And we said to them, okay, this is where we are at now. We've got this report. And just so you're clear, and someone said, like, oh, here's another report. And I was like, I hear you. Here's another report. But the difference is we're not saying we've got our report and tada, we're washing our hands of it. For us, that report is the first step towards something else, and we want that to build that something else collectively. What do you think it should look like? And so we've been trying to identify what the next 3 priorities should be, because we said we can't do everything. We won't have the money, we won't have the time and the resources to sort out all the problems in terms of health and well-being, let alone in Birmingham and in the current financial situation and everything else. But what do you think we should be focusing our attention on? And we were very clear that actually the way universities work, they work through publications and so on, and that will make the journey longer. And that will mean that sometimes there'll be outputs that are completely irrelevant to them. But actually, if they weren't there, we wouldn't be able to build on this, to be able to access more funding and to be able to carry on. And actually, they were really receptive to this. I think they appreciated the honesty of it. And I think they were also saying they appreciated us saying to them sometimes, we've not done anything in the last 6 weeks because I have been drowning in marking and this and this and that. And you're like, and they're like, you know what, fine, life goes on with us. And we've had different issues as well, and they'd be fine with this. But it's that kind of like investment in time. It takes a lot of time to constantly go back to communities and constantly say, this is what we're doing, and we're doing this for a reason, and that's not deterring us from this endpoint, and we're going this. So that tension is very much there. And I think the only thing I've done so far is acknowledge it and be really transparent about it. But it is really time consuming. And it does feel like it's taking you to different places at times. But yeah.
Yeah, I hear that, and setting up and establishing that infrastructure within the institution to really make this a part of your work is a really integral part of, an important part of that. But it brings me to another tension as well, which is somewhat related. It is the tension in time between now and then, or the present and the future, and the short term and the long term. Because I heard in what you were saying there, even there now, what should our next step be? What's our next priority? Where should we go next? And I'm just, I just have a reflection, because I've been working a lot with kind of futures and a foresight perspective in working with stakeholders to imagine a preferred future in a methodical sort of way, not just make believe of not wishful thinking, I suppose I should say, but methodically imagining a possible and preferable futures based on what we know is happening. And I'm just wondering whether you have a thought about what time frame you're kind of in, because I found it interesting that you were like, what should we do next? What should we do now? What we can't do the long term. So what would be the short term? And in a way, your solutions came out of, well, what would be a kind of a quick win, or what could we do sort of immediately? And I suppose there's a hope there that each of those stepping stones will get you to a future. But I'm wondering whether you think about what that future is. What does it look like?
Yeah.
And how does that relate to what you do on a short-term basis?
Yeah, I mean, it's going to sound really twee, but I think for me, the future looks like we have managed to make it slightly fairer. I would love to say we've removed all the barriers to inequalities, which is, but it's just we've made it slightly fairer, or we've made some voices heard finally. So this is where I'm going. In terms of time frame, it's a 5-year project, but I'm hoping that some of the consequences of some of the outcomes of this will be much longer term. So if we're able to work with Birmingham City Council to change the way that funding is allocated in the city so that it's more inclusive, and so that underserved communities are actually more likely to benefit from the funding, then I will see this is a longer term outcome. The difficulties I'm working with Birmingham City Council when they've just been made bankrupt. So it's very interesting to have conversations about how they should be allocating money at the moment. So that's actually making things really, really tricky. And it's slowing everything down as well. So when I'm talking to services in Birmingham City Council, they're telling me literally, this is how we're operating today. You could call me tomorrow and it might be completely different. I don't know. I don't envy them. I can't imagine what the uncertainty is like of constantly feeling like your service could be closed down or changed altogether, but that's making it particularly difficult. So we've had to be transparent about this. Another issue I've had with time is, and I mean, we've always known it, and COVID highlighted it as well, is how quick volunteering community organizations are at doing things. And the university is really slow. We are so slow at doing things. And for reasons like we'll have to stop to publish something, because if we don't publish that one thing, then we can't apply for more funding and so on. So it's also been about managing expectations from the very beginning. And so what it means is that having those little short projects in the middle has enabled me to maintain the relationship with the communities, because one of the reasons we had that community sandpits is because when we went to do the listening events, they were saying things like, you have come here so many times to ask us the same questions, and we are not saying any differences. And I was amazed they were still here, still telling us all those things, because they feel like, we're the 10th or 12th researcher coming in and asking the same questions and then not seeing any differences. And yet they were here still telling us everything about it. So I was like, oh, amazing. But I was really keen on not being the one who would walk away with the data and doing so I was like, okay, great. So, and that's always like, okay, some of the things like funding, the way it's allocated in the city, for me is really something I'm really keen on having as an impact, because that would be something that changes things meaningfully on a long-term basis and makes it more inclusive. But it's such a long-term thing, especially in the current situation I'm in Birmingham, that I was really worried that they think I'd have walked away on them again. And they wouldn't necessarily see the correlation between what they've done, what I'm doing, and then potentially I'm not saying it's going to change, maybe it'll never change, but if it changes, and so I was really keen on making sure that something's come out of it. Even if we haven't solved all the issues, they've had something really nice come out of it. And you know what, if it means they've had 12 sewing machines and that you've got 40 women who've got a sewing club as of the last 2 years and are able to like come and meet together and work together, they still think, well, we got something out of it in a way. And so every now and then we still have small projects. We've got someone from Refugee Alliance who wants to come on campus, and she wants to do like some workshop with the students, because she was talking to students at the hospital who was saying how stressed they were on their exams, and she's like, oh, can you come around the exam period and do like some kind of like you know, like henna or like things like this, and that really speaks to our student cohorts as well. I was like, yeah, that sounds brilliant, come on campus. And you know, and so we're maintaining that relationship. And also it's about that power asymmetry. She's the expert, she's the one who knows a lot more about my students and their cultural background, and she's the one who will actually be able to talk to them about health and well-being in the way that they don't want to talk to me anyway, because first I'm white and I'm also a lecturer anyway, so I've got that position of authority. So yeah, it's hard.
Yeah, I do. I love that example, because as you said, it kind of it demonstrates where the expertise is, and it sort of break down that notion that the expertise lies within the university researchers, you know, which we know isn't true, but people often act with that idea, even the people in the community. Because there was just two kind of anecdotes that I thought I'd share, because they speak to what you've been saying, and I'll wrap this into my final point, Rick and Richard, if that's okay. But well, firstly, being from Limerick, we have the accolade of being the most deprived city in Ireland. So a lot of my, particularly my colleagues in sociology, actually have been doing a lot of research in communities in Limerick. But there is a myth that goes around that apparently, I don't know where this joke is pointed at, but where researchers knock on the door and the person answers the door and they explain that they're from the university and they're doing research, and the person looks at them quizzically going, are you doing qualitative or quantitative? Showing that actually, because they've been so researched, they've become quite expert in research methodologies. But I think that speaks to the paradigm that you're trying to avoid. I'm working really hard to avoid. But the other one that comes to mind, though, as well, is that so there's a lot of interesting work in system change. And in a way, I think that's what you're trying to do. And you have this idea of what would unlock a change in the system, which is around how funding is allocated. And you're working kind of quietly towards that goal. But there is a lot of research on sort of participatory methods in system change. So when participants are guided through to map out leverage points themselves of where change could happen. So that process becomes participatory in itself, and where the actors who are involved can identify where the leverage could be. But there's still in all, I think there can be a limit there, because there's just a kind of a classic story of, researchers working with the community group around system change, and they the community are saying, we want to deal with crime. Crime is a big issue for us. And then, collaboratively, they understand that really it's not crime at all, but it's poverty. And then they develop some solutions around that. But when I hear those stories, I kind of go, wow, is just a slight increment in how less poor the community is that success? And I suppose I feel a little bit of a kind of a frustration going, are we limiting ourselves too much because we think about the present so much and how awful it is perhaps, and how uncertain it is? I think those issues are really pertinent. But do we then become very limited by what we think we can achieve, because it all just seems so overwhelming at the time, and going, well, if we just make some people slightly less poor, we'll be successful. And I just wonder that if communities had an opportunity to imagine their future community that's thriving, that maybe has loads of trees in it, maybe that's really what they want, or what would deliver on, you know what I mean? So that there's a kind of a vision of the future community, which isn't just about making the present slightly less worse. I just wonder about the role of that. And that's my last kind of shot over the bow kind of comment about the potential for system change framing for what you're doing when you're making participants part of the system change and not just a quiet long-term goal, but actually something that's you work for right now. Yes, and with increments, obviously, as you said, you need some kind of outputs. But then also, can we introduce more a future visioning perspective, which allows us maybe to be a bit more ambitious, even if it takes us many years getting there. But the ambition is also created by the participants.
Yeah. Yeah, I really like that. And actually, we also work with Flourish, which is in West Birmingham, and it's a collaboration of community and voluntary organizations. And they do that. So that's why they branded themselves Flourish. And it's this idea of thinking about what the future should look like. And actually, I would say that community organizations, community members, they have no issues, and they're very quick at thinking about what the future should look like. Not even in a very long-term way, and making it much more different to what they have now, and that would include actually more trees and so on, absolutely. And they would actually, the way they would rethink society, it can be quite radical in some ways. So we do have that. Where I'm struggling is with the systems, because if you bring that vision to the systems, they look at you and be like, you are insane, that's never going to happen. Already just saying to them, can you when you're writing the bid application, the funding application, can you literally just put 15% of it will have to be ring fenced for smaller? They're looking at me as like, no, that can't be done. And I'm like, that's one line to be added to, like, and they're so this is where the issue is. And actually, I'll be careful because this is recorded, but I've been talking to people in systems who did not believe the data I was presenting to them. And they were saying, well, those people just don't know how to access services, or those people just don't know how to get interpreters, or those, and you're like, yeah, maybe that data doesn't speak to you because you're not used to listening to underserved populations, but this is actually the reality. This is what's happening. So you're very welcome to come with us to Losos and find out what it's like at 7:30 outside of the GP surgery. But that's where my issue is. It's like, even if you have that vision, which we have clearly with Flourish, it's like, how do you bring it into the system? I haven't been successful there yet.
Yes, it's working with the the service providers and the policymakers to get them to do some visioning work, because they're so caught up with how the system works right now. It's seen as kind of impractical to do it in any other way. But actually, systems change all the time. I mean, again, COVID kind of showed us that for good or for bad, systems can go through major change. So it's just about kind of unlocking those kind of ideas. But let's talk more about that.
Yeah,
I'd love to join you on those conversations, Celine. I think it's be really interesting. Sorry, and that's great. Thank you. So I'm sure my time is up, Richard. Thank you.
You feel free to take a few more minutes if you like. I mean,
no, that's okay. Yeah, I was working to the time frame, so I think we're okay. Yeah.
Just a quick observation here, Celine. The 3 files that you had sent earlier so kindly. One of the reports, which was looking at community connections engagement, that's the name of the file, page 8 in particular, I absolutely loved the questions. So you've got 6 questions where you talk about the shared approach that you've taken. And it doesn't look like a shared value creation. It's more towards shared value co-creation, which is really difficult to do, particularly if you've got an enhanced stakeholder approach. But I mean, obviously I've got quite a few questions, but just a small observation here. Page 8 here, I've got 6 questions, and you're asking questions like, what outputs do you think will come out of the engagement activities? What are the benefits of the collaboration for all parties involved? And it's really interesting when you look at the finished product and you sort of trace back where it came from to come up with 6 such pointed, open-ended questions. It's really rich. Just a quick question, Celine. What your previous research informed this sort of 6 questions that you have got for this research?
These questions come from working with the community partners, so they're the ones who helped us put it together. So because when they were saying, and I think you've got the quotes in there that are saying things like, yeah, they've come here so many times and they've asked the same questions over and over again, and we're like, okay, so what do you think meaningful engagement means to you rather than to me? Because for me, on the funding application, traditionally things are changing now with impact and knowledge exchange, but traditionally, I would have been able to put in a funding application, get you a few vouchers, get your data, walk away, write my stuff, and never come back, right? And clearly, this is not working for you. Clearly, this is even harming you, and this is actually creating even less trust in institutions, not just the university, but institutions more broadly speaking, especially from communities who are not necessarily inclined to trusting larger institutions, especially if you're talking to refugees and asylum seekers, that they don't want to sign forms and consent forms and all the rest. So we said to them, what do you think engagement should look like if it was to be meaningful, and if it was to be respectful, and if it was to help restore trust? And this is what came out of the conversation, actually.
Thank you for that. Yeah, I've got a couple of questions, but well, let's move to Richard. Richard, would you like to take over?
Thank you very much. Thank you very much indeed, Rick, for organising this, and Celine for a fascinating insight into your work, since we engaged a couple of months ago the other way around. I'll just say, just for my background, I mean, I really need to start by saying that I'm not very active in actual healthcare research at all, as you probably know. So I think my perspectives are going to come from a slightly longer distance, my sort of more general philosophical and ethical interests in research and social research. So yeah, I've made a few thoughts, put down a few thoughts. A lot of them actually were inspired more by your this handbook that Rick just referred to, the Community Connections Engagement Handbook, which steps back a bit to look at the methodology. And yes, I guess some of them will feed into the more specific healthcare research you reported. But I mean, mostly I'm so impressed by all that you've described, and you know, as Anne-Marie has said, it seems to be fantastic work making a difference, and I can't fault it. And I'm not close enough to the coalface to be able to comment in much detail, I think, on the actual specifics there. But just to say again that it looks absolutely fantastic initiative, and I'm pleased to see that it's due to carry on, and that despite the demands of marking and everything else, you've got some infrastructure in place at least, so that you can keep up that engagement, which, as you say, must be crucial. I was thinking about the whole idea of community engagement and participatory research. My main experience of doing this came from a long time ago, before I did my doctorate, when I was doing a placement with an organic farming charity, and they got some funding from DEFRA, and this is going back to about 2003, 2 or 3, I think, so more than 20 years ago, to do some research on organic farming in a participatory mode. And I think at that stage it was quite an early trial of participatory research. And so I remember just sitting through this series of meetings on the day, because I was there as an intern really, and seeing how things unfolded, and all the brainstorming, the flip charts, the mind maps, and how eventually they settled on some areas to turn into work streams for the following months of the project. And how, in some sense, how arbitrary it felt to me. The conversations flow in a certain way, and then you end up with this as your research agenda, and then you do it. And I mean, you certainly couldn't say that they were following a predetermined agenda. They decided to work on biodynamic farming, you know, investigate planting by the phases of the moon and things like that. So I suppose I come to this sometimes wondering if what's the right balance between stakeholder-led and theoretically guided research. And I don't have an answer here. I'm sure the answer is somewhere in between the two extremes. And I suppose it strikes me that in the handbook, for example, it talks about the importance of having equal relationships rather than transactional ones, where the researchers stand on an equal footing to the people that they are researching and working with. And I suppose from an abstract point of view, I feel there must be something more to say there, because clearly they're not equal, at least they're not identical. The researchers come to this, as you've said, with our publications to write and our funders to please and so on. And we're not coming to it simply as people who get up in the morning and have to feed a family and manage our own health, although we may have to do those things as well. So I was wondering how to unpack that a bit further. What sort of equality is it that we're aiming for? What is the ideal here, and how would you know if we had it? And one, yeah, I don't think I have any answers, but one framework that I thought of, which I did come across a long time ago, actually, which...
You muted yourself.
Sorry, press the space bar. Yeah, so relational proximity framework is something I came across from something called the Relationships Foundation. And I think they've been going for, again, probably more than 20 years. But they suggest 5 axes of assessing what they call relational proximity, such as you might think about when you engage in participatory community-led research. And one of them is commonality. To what extent do these partners actually have the same goals? And I suppose on the face of it, not at all to start with in this context, but of course to some extent, yes, there will be shared goals. I'll just run through what the 5 are in case it sparks any thoughts, I suppose. Another one is parity, and that is about equality, really. That's to what extent are the partners in this relationship equal in power. Another one is multiplexity, which is in how many different media does this relationship exist? And they tend to say face-to-face is one important one, but there are others as well, of course. And then that relates to the 4th one, which is directness. How direct is the relationship, where face-to-face is probably the gold standard. And I guess face-to-face in relaxed surroundings and over time. But there can be relationships just mediated through online communities or through print. And then the final one is continuity, or the longevity, the time dimension of the relationship. So I just thought I'd throw that out there in case that's helpful. And it probably fits already into things that you're already working with. So it might just be another framing of familiar concepts. And then another thought that I wanted to raise was, you mentioned, and Anne-Marie as well, how some communities seem to be over-researched, and perhaps partly because they're easier to access, and also, I suppose, because they're more recognized. And so in terms of the ease of access, and I think you mentioned at some stage the trying to work with men, or do you say with young men? Perhaps you just said with young people, but I was thinking particularly, I think the community you ended up working with was predominantly female and of a certain, I guess, of a certain age range, although perhaps it was quite broad. And I was just thinking about the need to reach other communities, and how do you decide which communities to try and reach, and can you be community-led even at that stage? Well, I guess at some stage you have to decide where to start as a researcher and which communities you try to reach, and then of course see if they will respond, and if it's completely impossible, then you can't really research them except indirectly. And I was just speculating that perhaps young men might be a particularly difficult community to reach, which might nevertheless have major healthcare concerns, or indeed other concerns. I think you mentioned, I can't remember if you mentioned criminal behaviour, but it might be, and of course I'm stereotyping here, but it might be that there are reasons to want to investigate certain other communities. And then I think that led into some thoughts I had about how do you actually recognize a community. So this may be stepping back to quite a theoretical level, but the handbook mentioned some different high-level kinds of communities, like interest groups or interest-led, identity communities, and experience. Yes, communities of experience and also of place. Mm-hmm. And I started thinking, I was wondering, I suppose, what's the difference between a community of interest and a community of identity? Because in some of the examples given of interest communities, I thought might have been rather identity communities. So I think you mentioned racial and ethnic backgrounds. And so I was just wondering, I suppose, how robust this typology was, and whether it matters. Maybe it doesn't matter. Maybe it's just a sort of aid to getting started. But there are other issues, aren't there, about how communities do they exist? Are they natural kinds, like species, that we are trying to recognize and then engage with? Of course, they may be in some cases, like an interest community, they might be self-creating, but they're still there for the researcher to recognize. There might be cases, I guess, where researchers have essentially created the community. From some reading I did on philosophy of religion, I understand that Hinduism was in some sense created by the West. The West had recognized that there was Catholicism and Protestantism, and then they thought, those are, let's call them religions, let's see what everybody else has. And they soon recognized Mohammedanism and Hinduism, even though the people of the Indian subcontinent didn't think they all shared the same religion or even have a concept. So are we doing that in any cases? And I think the handbook does mention things like the BAME community, and possibly that's not really a community anymore, if it ever was, or a helpful label or whatever. So I just thought that's something that that obviously can be problematized. And yes, and you could apply some of those other dynamics of relational proximity, those criteria to explore the existence of communities. You might, I suppose, want to say a community can only exist with a certain amount of continuity and multiplexity. So I sometimes wonder, people talk about, let's say, the LGBT community. Is that a community of people who know they're in a community? And is it one community or is it several? And the same could be said for other concepts. Just look at my notes. I think, oh yes, I mean, another pressing need of our time is to address loneliness and isolation. And I suppose in a sense that's an anti-community, a whole set of people who would be much better off in a community, arguably, or in various communities. And it certainly has health implications, health and well-being implications, loneliness. And yes, perhaps my final comment or question then is, and I'm sure this is already thought about and not new, but in whose interest are communities defined? When we say here is a community, are we saying it? Is the community presenting itself as a community? And what are the power dynamics in articulating that there is a certain community to investigate? So that's just a bit of a collection of thoughts in no particular order, but yeah, I hope that's helpful, and I'd be interested to hear if you want to respond to any of those comments. Thank you.
Thank you. Yeah, thank you. It's really interesting. I've made some notes. I'll try and go through them, but if I forget anything, just let me know. Yes, going back to the balance between theoretically led and participant led, I think it might depend on the type of researcher you are, to be honest. And I think that there might be some researchers out there who might not be as comfortable being led by communities as well. So there might be a personal element there. For me personally, I mean, I'm a sociologist, and the first people I was working with were children and young people. And I spent a lot of time arguing that we're not listening to them because we're always constantly saying how immature and incompetent they are, and how us adults, we know everything, and therefore we should make decisions on their behalf. So if it was up to me, I'd get the kids to tell me how schools should be organized, and I'd rewrite the whole school system based on the experts in schooling and growing up, rather than the adults who have done it 30 years ago or something. So that's already on a personal level. I'm happy to be led by participants, but I think you're right. They're different roles, aren't they? And I think for me, it needs to be theoretically led in the sense that first, you don't want to reinvent the wheel. So let's not do research because all of a sudden we're interested in something. So maybe the role of the researcher is to say, oh, hold on, guys, let's get access to existing knowledge and seeing what exists out there. What do we know? Are there any gaps? How do we fill those? And so on. And also making sure that the research would be ethically conducted. So making sure that, you know, you're the one who has been trained to do research ethically. So you pass this on to make sure you're not going to be at fault. So for me, this is where the theory really kicks in. And then you have, it's about how the researcher wants to view that relationship. But I think for me, the more participant-led, the better, to be honest. How do you know if you've had that kind of equality? I think I'm really grateful for your suggestion with the relational proximity framework. I'll look into it. I hadn't heard of it, so thank you. I do think there's also an importance that there's the need to start paying attention, and of course I'm going to say this as a qualitative sociologist, but there's a need to pay more attention to qualitative data, and this is one of the things I'm working on with the NHS actually, and also the public health and the council. And one of them came back to me and said, oh, that really resonated what you said around this idea that this is not because it's qualitative data. This is not because we're hearing people's stories that we shouldn't pay attention to it. Because too often we'll be saying, oh, you know, our stats are good. If we're looking at GP access, we are actually doing better than in Stourbridge. Therefore, we don't have a problem. And actually, you're like, well, but when you're looking behind the data and people are saying all this issues. So if you were to pay equal amounts of attention and credibility to qualitative data, and the qualitative data from the participants is saying that they felt like the relationship was equal or how to address the symmetries of power and so on, then for me that would be one of the ways in which to assess it. These are the notes on the framework, so I will keep that on in mind. Thank you very much. You're right, some communities are over-researched. And we were partly guilty of it in a way, because when we were trying to get access to underserved communities, we worked with Citizens UK, we went through their networks and so on, and we established relationships, and it was people who were already happy to be out there, who were happy to come first and be part of the project. So what we're finding though now, and we would have never been able to fill the room with 100 people as we did in March this year, 2 years ago. What we're finding now is because we have worked with those communities for 2 years, and then another one joined in, and then another one joined in, and we're seeing that people are starting to talk to one another, and they're saying, actually, those guys are community connections. You can trust them because they've done this. Or you look at that sewing club, that's because of community connections. And so we're starting to see people who are more interested in taking part, and some of them have never, ever been involved in research. So we're starting to see doors open where they hadn't opened before. So this is kind of almost a long-term plan if you really want to go into less research communities. But you have to be the kind of researcher who's happy to accumulate smaller amounts of funding. So you're constantly bringing something new rather than you're going for that big grant, and then you're working with those 5 or 6 communities that have been traditionally underserved, but actually are the ones who have been accessing research in the past. But if you're happy to have loads of seed corn projects or loads of smaller projects, then you see doors open, and then maybe later do that big application. But try and, unfortunately, the university system is not set up for it. If you're looking at how you want to be promoted, the bigger the grant, the better you do, and therefore you're going to be promoted more quickly. But if you are happy to have a little bit of a longer term view, or if you're committed to the brighter future that you believe can happen, then maybe that is enough. Well, I mean, for me, it's enough to go for the smaller parts of many and actually working toward this. And then later on, maybe we'll do that big grants together. But for now, it's about this. So yeah. when you talked about how can we tap into communities that have not necessarily been coming forward, so men, for example, also children and young people, and that's where we're going next, actually. So a lot of people were talking to us about how they were concerned about their children and young and their teenagers. Some parents were actually calling online lines to try and find out advice on how to support children through anxiety and so on, because they didn't know where to turn anymore. And what we want to do is not rely on adults' voices, but actually talk to the children and young people themselves and find out what is it that's going on, what do you think is important for you right now, what would you change, and so on. So we're gonna work on this. And when we were at that round table with the 100 participants, I said, okay, this is where I'm going next. It's February. I'm going to start sending emails out in April. But I haven't got anyone lined up. So I was trying to be as transparent as possible, saying it's not like I already know where I'm going. So if there's anyone in here who's working with children and young people and wants to be involved, let me know. And I got about 5 people working in different organizations who came forward and said, can you please come and talk to us? And I know that 2, maybe 3 of them have never, ever been involved in research before. And so for me, that was like, okay, we've been able to restore a little bit of trust, enough for us to be able to access different groups. And we're also doing like different methodologies. So I'm a Lego Serious Play facilitator. This is probably the proudest certification I've ever got. I feel like I'm like, this is the one I want to frame in my office. But we've been using like Lego to bring in people to talk about health and well-being, and we've trialed that in the university, and that managed to get some men coming to the groups, which we were really surprised about. And we got some men from racially minoritized backgrounds who came forward and talked to us about mental health, and we were like, this is amazing. And what really helped was, we can call it aesthetic distancing, but it's called lots of different things. But it's around this idea that I'm not asking you about your mental health and what's going on, but you're telling me what is it that you've built, what is it you've created, and what those things represent. And so they were saying, oh, so this is like that man is actually trying to go there, and this transparent brick is supposed to represent the transparency of the system, but it's fallen on the side because it's not working. So instead, it's got to go over that bridge or whatever. And because they're telling you a story and you're not allowed to question the story, all you can say is like, oh, why did you pick a red brick or whatever? And they tell you what it is. They had that, they felt like they weren't talking about themselves, but talking about what they created. And also because they were in a community where everyone else was doing, it helped, I think, to create that comfort and confidence. And so the subsequent groups, we got a lot more men, and we were super surprised at this. So we're going to keep on trials. So I think it might be so it might be around long-term access and getting that going straight for the ones who are saying yes, we're ready to talk, and actually waiting for the ones who start restoring that trust, but also getting like novel methodologies in different ways. I'm not saying Lego is the answer to everything, but that was one of the ways we managed to get it. For community, I fully agree with you. I think I did my PhD on sociology of religion, so I totally understand what you're talking about, how the Western Christian, liberal Christian concept has framed religion for the rest of the world in a way, and how we might be guilty of doing that again. I think, and actually, I did talk to my students because I teach an education module, and I did say to them when we were looking at the protests in Birmingham, I was like, we're not talking about the LGBT community. There is no such thing as one LGBT community, so we weren't doing that. But it's true that in research we do use it. And in the handbook, I talk about the 4 different types of communities because they're the ones that the Birmingham City Council and Public Health use a lot. And actually, the council is in the process of publishing what they call, I think, community profiles, and they're health profiles based on communities. So they've got a Pakistani profile, they've got an LGBTQ plus profile, they've got a deaf population profile, and so on. I understand to some extent the value in wanting to flag up some issues at community level. My real issue is intersectionality is lost. So what happens if you're LGBTQ plus and deaf and Pakistani? Are you either 3 at the same time or nowhere? So there's a real issue here. And around essentializing whose voices are not being captured in those profiles when we're saying, well, this is what the people are saying, from Pakistani groups. I'm like, there's a power again dynamic going on here, and that needs to be acknowledged. So if it happens in research because it has to, because you need to flag up trends, or you need to like shed light on particular issues, you still need at some point to address the issues that come with creating communities, or using the term communities, or the power asymmetries. And that actually goes back to even, you know, we were talking about I think it was something around who are we getting what the same thing, or to what extent do people want to have the same shared goals, right? And actually, from my perspective as a, you know, I would say that we probably don't. I think even in that group of 20 people, we probably all came for different reasons. Maybe someone wanted a hot cup of tea that day and just turned up for the tea. Maybe someone wanted to be part of the group and didn't want to miss out. Maybe I wanted to be there because I wanted to find out stuff. Someone maybe was there because they have they were in a car crash a few months ago, never were able to go to physiotherapy, and were really upset about this, especially as their mother-in-law was in there. Someone else wanted to be in there because their daughter was pregnant and was too scared to go to the midwife. So they all came for different reasons. And I don't think that necessarily is an issue, because you can have lots of different outcomes in which people can still find what they were looking for anyway. So that needs to be addressed when we're talking about communities. So I guess it's about this kind of like almost like asterisks, you know, you're acknowledging the flaws in the community term, and it goes beyond this. It's also like, you know, and I think we're trying to address it in the handbook, and hopefully we've made it clear, but it's like, when you're going to communities, is who is giving you access, and what power do they hold in the community, and who is not being given access at the same time. So if you're going to the mosque and the imam is giving you access, it's more likely that they're going to give you access to particular groups of men, and unlikely to give you access to some particular group of women. And so and it's, again, it's acknowledging this. So I don't think we'll ever be able to say we've looked to absolutely everyone, but as long as we're very clear that we have, you know, met barriers, or that we've not been including absolutely everyone, I think this is important. And that's where I'm hoping I'm wrong, but that's where my concern is when we're looking at the community profiles that are going to come out of the Birmingham City Council. I'm just worried that they're not going to acknowledge intersectionality, the power dynamics, the voices that get silenced in the process. But hopefully I'm wrong. We'll see. They're going to be published next year.
Thank you very much. Thank you. Anne-Marie, you want to say something?
Yeah, thanks, Richard, because I was just wanted to come in from what you were saying there, and some things that have come to my mind. Actually, you've just raised another one, Celine, which I'll try and preempt my comment with, that, you know, even though you have these close relationships with your partners, they could kind of let you down, right? And by not doing something, and there's something interesting to reflect on there. But it was definitely back on the point that Richard was bringing in there around the researcher-led versus kind of community-driven, and again the sort of tension there. And I was thinking about this, but also really interested in the Lego method, right? So we're going from kind of research design right into method, but they link there. And I think there's something really interesting about kind of what Lurie and Wakefield call inventive methods. So they have a lovely little book on inventive methods, and so the materiality of the methodology matters. You know, a survey very much embodies a researcher-led. By its nature, you know, you just have these small amount of answers that you could possibly give. So that's at one extreme, where the researcher has decided, pre-decided everything, if you like, right to very much an inductive kind of approach. But I think that idea of the materiality of the methodology mattering is quite an interesting one. But I was thinking again of I've been looking at Michael Gorman's work, his work is more about interdisciplinary research, but there's a common point here. In a way that you're almost forming an interdisciplinary research team with your community groups. So his idea of trading zones is quite interesting. So this space that opens up between disciplines, and they talk about boundary objects in that context. And acting as a way for the different members of that trading zone to kind of anchor themselves. So it helps with the interaction, and it helps with the collaboration. And very much to your point as well, Celine, that not everyone has to have the same goal. This is one of my bugbears with a lot of the partnership research, is that they're like, oh, at the beginning, everybody has a shared goal. Then you're like, no. So back to Michael Gorman's trading zone. So he talks about sort of this idea of a boundary object. And I think it could be an interesting, at some point, for us to reflect on, because the boundary object could be this concept, for example, what is essentially a theoretical concept, but which can have a shared meaning with your participants as well. So just recently, I was working with a number of small food businesses. So it's slightly different, but interesting, in terms of very much, of very, very, very tiny businesses. And we were looking at some of the challenges that they faced. And we used a number of these kind of inventive methods, not Lego, but we were using kind of visual frameworks and tools and canvases that they were working on, which gives them a kind of a level of autonomy as well. They're working on a canvas, so the researcher can go into the background, but we've already inscribed a lot of the theoretical ideas on the canvas. So in a way, it can act as a proxy to us without us having to lead, which is very useful. Again, it's around that materiality of the method. But through their conversations, one thing that sort of struck a few of us in the room was like the issue of scale became quite interesting or important for them. So in their world, they were being pushed to be bigger. They were feeling this driving forces to be bigger. They were trying to navigate that. Some wanted to stay small and so on. So this idea of scale, but of course, scale for us as business researchers was a really interesting concept. So we were sharing this idea of scale with them. And they were like, oh, okay, I see what you mean. And so we shared a conversation about this as being both an empirical and a conceptual concept, or theoretical concept. And we could share it then. And they're like, okay, I get behind this idea of scale being the concern here, because that's really my life experience. And for us, we were like, we're interested in scale as a theoretical concept, and we can go somewhere with this. So I think together we can work on this idea of scale. So the research and the community issue are the same one now, because it's a boundary object which we can both interface with in different ways, but we are working off the same boundary object. And I was wondering if that might be a way for us to think, one of the ways for us to think about this, resolving this tension between either research-driven or community-driven.
That's really good. Yeah, I think that's a really good way of looking at it. Yeah, thank you.
I'll share the Michael Gorman's work with you. You can have a read.
Thank you.
As I said, he's written very much in an interdisciplinary, so it's a different framing, but I think it can. There's a correlation there.
Yeah, no, and it's a nice way to also try and tackle this issue around common goals, which comes up quite a lot. And I guess maybe that's something that we failed to even tackle in the handbook. We didn't even talk about this, and maybe we should have had.
Yeah, it's a difficult one though, isn't it? Because I think there's multiple frameworks out there in cross-sector partnerships, which very much set this almost a linear trajectory, and it becomes almost evangelical. On the first day there were shared goals. On the second day, and it's never like that, is it? It's the linear models don't help at all.
Yeah,
so
and that was something that we were pressed for by some colleagues actually in academia and in the NHS, and they were saying, can you please create a model? So they were really keen on us having a model out of the handbook, and we're like, no, because actually there is no one size fits all when you're doing community engagement, and it might be that one particular model works here, and actually one particular model will work and will need to be flipped on its head halfway through, and sometimes it might be that you need to take a couple of models and merge them, because you have to kind of go with the flow. I did I'm doing a coaching certification, and I feel like there's a little bit of this in there, where you constantly have to reassess where you're at and constantly see where your participants are at and adapt depending on where, and rather than being like, well, no, we should be on this stage today, so therefore we will be doing this. I think that could be that could contribute to the detriment, to the damage we do to relationships and to communities actually.
Yeah, I really agree with you there. And the tension again with our publications, the reviewers love a model as well. So
yes.
Yeah. Sorry, Rick, go ahead.
Conceptual contributions. Now I agree with you, and Mary. It is quite enriching to see how the space for participatory development, or sort of as a methodology, how it has sort of evolved over the years. I mean, I first got introduced to this by Robert Chambers, who was also my dissertation supervisor, which was at Institute of Development Studies at Sussex. And so when I was working on climate change, tourism, poverty, climate change, and tourism, this was one of my first research projects when I was in Oxford. It's quite enriching to see how the conversations have changed, because the way we define spaces, places, and also institutions, they have also significantly changed. So I think the role of institutions remain paramount, but also the spaces that we study and interactions between the institutions and those places informs the way participatory research can be designed. So I'm just going to keep it to the point because I'm conscious of the time. This question is more sort of on a sort of a ground level, practical, operational level, because one of the areas that I've sort of almost always worked on have been renewable energy technologies and how certain communities have been using solar energy technologies in particular. And so I've had sort of ground level experiences where it was rather interesting to have, or to try and have all the stakeholders in the same room. So who is providing the technology? Who is funding for it? Who is providing the technology training? How is it being used? How long are we able to keep track of those entrepreneurs? And in particular, I was looking at women entrepreneurs. So the timeline, which I suppose one of the questions that Anne-Marie had also asked, is also one of the things to look at. My question in this particular case, because I looked at the report that you had published, and you also said it has been going on for over 2.5 years now. And you also ensured this continuity of the projects, which is fantastic. One of the sectors where the turnover is super high is actually the volunteer organization and the charity sector. So how do you deal with employee turnover, or how have you dealt with employee turnover over this period that might have occurred in some of the institutions that you're working with? Or maybe you have not faced a challenge, I don't know, but just curious.
Yeah, so in some cases we have had people leaving, and in that case they've taken us with them, and they're saying, oh, we're going in that particular organization, do you want to work with us? But we haven't lost the link to the original organization because there were still some people. So rather than having just one person, it's about trying to know more than one. Another one moved away because she got a really good position in the council, not in Birmingham. And she made sure that when she left, she introduced us to 5 people, so we would be able to. So I think if they see value in the work or the relationship, they make sure that relationship doesn't go away when they go. But to be fully honest, most of the people we've been working with, most of the organizations we've been working with, we haven't seen a high turnover of staff the way you normally do. And I do wonder if this is because they're so small and they're so place-based, actually. So a lot of the people we're talking to are very much driven by the desire of wanting to support the local families or the local area or the women who live on the particular streets that they're serving. And they are part of that community. So rather than they drive into work and they do their work and then they leave and they might go and work somewhere else, they literally live on that street, and they open the door to the house down the street to other women, and because they are trusted by the local families, that's actually why women are able to go to that particular organization. So we haven't seen that as much yet. And yeah, we've been working with them for 3 years, and so far only 2 people have moved on, and we've not lost the relationship with the organizations.
I mean, that's quite interesting. I mean, there are cases, I remember doing this research. It was a small sort of funding by ESRC years ago. on biogas plants, and I was in a rural setting in Karnataka, south of India. And this particular organization had been supporting the community for over 20 years. And this gentleman said, let me just take you out on a ride to introduce the villagers and the village. And it's okay. So I got on the bike, and he was, interesting road infrastructure. And we were going through hamlet via hamlet, not really village, really tiny ones. And he knew everybody by the names. And they were sort of waving him back with such sort of trust and familiarity at the same time, very respectful. So that was quite a unique organization in the sense that nobody ever left their organization for 20 years, starting from the founder, the 3 project managers, and others. But in some of the research that I did in microfinance or revolving funds or solar energy technologies, the staff turnover was a problem. So that sort of interrupted the project flow. And sometimes they would not simply change the job, they would change their careers. And, sort of trying to touch base with them after 3 or 4 months, and turns out they had left 2 months ago, because there's always a sort of harmonizing the balance of how much to communicate with the partners and how often. And if it's been 2 or 3 months, and it seems like that's been a long time, there's a lost connection there. So it might happen in some cases. I mean, that's good that you only had two rare cases. The second question, again, keeping it brief. So obviously, there's a lot of delegation in the process, and it's very much partner-led, as you also said from the beginning, particularly when it comes to organization and coordination of events and participation. How much was the involvement with the university in general? How much did you actually interact and work with them, so to speak? How often was that? The partners, the ground level partners, the bunch organizations.
Quite a bit, to be fair. I think we were on site about once a month at the beginning, and then once the community project launched, less so. But we were in touch via email, which we realized they didn't really work. They don't work via email. Universities work a lot via email, but not volunteering community organizations. So we've got WhatsApp groups. And so we talk a lot via WhatsApp, and that helps maintain the relationship. So sometimes they'll send and it's about not just doing things that's related to your project, right? So for example, I've been invited to, at the end of, it's going to be the end of Ramadan really soon. And I'm invited to a celebration with the community, and I'm going to go and I'm going to, celebrate and thank them for hosting me that day for the food and so on. And that has nothing to do with my project, but I'm still showing that, I'm invited, and of course I'm going to turn up. Actually, it's a privilege to be invited. But you maintain the relationship like this as well, because they are very active within the community. So they're constantly doing stuff. So it's just even about saying oh, can I pop in and have a cup of tea and see what you guys are up to? And you're not doing anything. You're not bringing up any research. You're just literally having a chat. And they'll tell, and sometimes actually they're saying, oh, look, we built all this stuff for the kids and we'd like to get some more puzzles in the future. And you realize, oh, are the kids really into puzzles? And then you're like, oh, maybe I'll do a puzzle related kind of activity when I come and talk to the children. So yeah, so that's what we've been doing a lot of. And also it's because I've got the NHS partners. Sometimes it's the NHS partners popping in there, and then they've said, oh, we've done a house literacy session. And so that maintains the momentum as well without having me to go there. So yeah.
Yeah, finding that method and way of sorry, Rick, I was just saying, finding that way of working is so vital, isn't it? I mean, that's even across research projects as well. You know, can everybody work on Teams? Oh, we don't work on Teams. We only work on Google. And it actually, the more tools we have, the more difficult it is to find the common one. So I agree. WhatsApp becomes this kind of leveler that nearly everyone. I've worked with farmers in Africa as well, and that was absolutely the only way to work. Even with my university colleagues in Uganda as well, as WhatsApp was their main mode of communication. It's fascinating, actually. It's an important part of the collaboration.
Yeah, and I wish like the time it takes to maintain the relationship was more valued. And that's why it's really frustrating that the funders or even the structures don't necessarily realize how much time it takes to maintain those relationships. So me going to an event on the for a whole afternoon is not going to bring anything to my research. I'm not going to do any publications around this. I'm not going to get any funding out of this. But you maintain that relationship and it's not valued. And it's a real shame because actually then they'll come to you and say, why don't you have that relationship? Because you had it 2 years ago. So hopefully, you know, we'll see change there one day. But
no, it's a really good point, Celine. It's where they're very the funding is, it's so outcome driven, you know, output maybe even more specifically.
Yeah.
The cultural context is also important because I mean, I had similar experience when I was living and researching in China. Forget email. I don't think I've ever used a single email for 2 years of my time there. Everything's got to be on WeChat. A very similar experience in Central Asia, in Kazakhstan. Everything is on Telegram. So, I mean, part of the reason why I was asking this question was also because how does it shape and, you know, in a way maintain the equal versus transactional relationship that has to be defined at some point. So, you know, you have to engage at a personal level as well. Also getting texts or communications at very odd hours, you know, during holidays or weekends. So it is work, but at the same time, it's a lot more than that. So the personal communications, the interpersonal relationships that you create also informs the output significantly over time. And also there's so much that follows after the projects are over, you know, in terms of sort of follow-up work and also, you know, ensuring continuity of the impact. So which is great. But yeah, it seems like WhatsApp is becoming the standard. Emails are just I don't know
it's
what
really
Richard.
tricky, isn't it? Because if you don't have a work phone, then that can affect the work-life balance, and that's an issue. And I know that even if I had a work phone, they don't want to allow WhatsApp on it for security reasons, you know, at the university, so that wouldn't be allowed. So you have to be really strict into muting and archiving all the groups comes at 5 o'clock, and then de-archiving them, you know, on the Monday morning and so on, and seeing what you may have missed in there, or using the so you have to have that kind of like really strict, you know, boundary to make sure that you're not, because it's the voluntary the sector, right? So you will get a text at 9 o'clock on a Sunday. You will get a text on the Saturday night, so saying like, well, if people really even call you on Friday nights and saying, oh, by the way, I had an idea, and you're like, yeah, great, but I'm picking up the kids and I'm not hearing the idea now. But to be honest, I think it's an issue, and I think hopefully the universities would look at this one day so we can address this properly, because the work-life balance is really important, and this is being eroded so much for multiple reasons. But it's also about being transparent with the partner and be like, you know what, I totally appreciate it, but I don't work on a Friday at 5 o'clock. So, and like when my phone rings, I'll just let you ring out. And then on Monday morning, it'll be 9 o'clock. I'll be like, I'm so sorry, but I don't work at that time, so I didn't pick it up. And they usually say, yeah, okay, fine, no problem. And then
It's difficult. I mean, there's so many platforms that some of them I never heard of before. This is a few years ago. Well, messages would disappear after 24 hours if you haven't picked them up on time. Snapchat or one of them. And somebody was following this up on a Monday. I had no idea which platform was that on. But yes, these are some of the practical, I think, realities of a social science researcher. So I would like to wrap up the session because I'm conscious of the time. But Richard, I'm just wondering if you'd like to. Do you have something to add at this stage?
I just had a thought from 10 minutes ago, which I've just been toying with, but it just goes back to the question we were discussing before of shared interests or not in a community. And it's partly because I was reflecting on my on my pluralistic evaluation framework that we discussed last time, and I was thinking surely this might be relevant. And I need to think about it more. But I was just thinking that the different aspects that are used in that framework, which come from the reformational philosophy, it'd be interesting, at least for me, I think, to explore how they can help to define communities. So, for example, the sort of the last aspect in the list is the ultimate, to do with religion, ideology, vision. And I was thinking you have communities of vision, which sort of maybe quasi-religious in their shared vision and sense of duty and where they're aiming. And then you've got the ethical or moral aspect, and you've certainly got communities of care, which again tend to have perhaps have a lot of shared, a lot of commonality. And then you've got the jural or justice aspect, and you've got communities that are united around a campaign or a cause. And I don't know, it'd be an empirical question as to whether as we go down this list, we end up with progressively more fragmented or diverse communities in some sense, maybe diverse in terms of interests, but you get to the economic aspect and you have communities of interest, social aspect, communities that exist for their social function, I suppose. And then probably at the end of the list going downwards, you'd have biotic communities defined perhaps by family or sexual identity or something like that. So that's just something I'm going to take away and explore a bit further, I think. But yeah, Celine, you were there when I presented it, so you might, if there's anything there worth picking up, I'd love to know.
I've just shared the link for Anne-Marie if you'd like to catch up with the PEF. I do hope that we can continue this conversation and would like to know more as the project progresses. Sorry, the City Council is shutting down. As there are quite a few, actually. I think about 90-ish city councils across the country that are shutting down, which is oops. But
yeah, I don't think we're shutting down. We're just bankrupt. We just have
yeah,
no money.
well, right. Okay, let's go with that. Yeah, we will also look at the other clips, the video clips. I had a look at all of them, I think last year and also yesterday. They're great. Thank you for making time, everybody. I do hope that we continue the conversation. I've got each other's emails. I'll also send a follow-up email shortly after the session is over. And
Thank
yeah,
you.
have a good rest of the break if you still have got a few days off, because we do, Richard and I do at Winchester. No, okay.
Days off teaching.
But thank you so much for having me and for your comments and questions. It was really helpful. So thank you, everyone.
Thank you, really. Thank you.
Celine.
Have a lovely rest of the week. Bye.
You too. Bye.
Thank you.
Bye.
Bye-bye.